Good day, and welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of February 27th. For the benefit of the radio listening audience, I am Government House Communications Director Richard Mota. Dr. Ty Hunt Caesar is joining me this afternoon for the latest COVID-19 data and information on where Virgin Islanders can get a free COVID-19 test, vaccine, and booster, and to discuss the importance of the effects of long COVID, which is why that vaccine and booster is important. Along with Dr. Hunt Caesar and me is Commissioner Kimberly Causey Gomez, who will provide some critical public information for Medicaid and SNAP recipients regarding the federal government's ending of the national public health emergency for COVID-19. But before we go to the Department of Health this afternoon, I want to wish all Virgin Islanders of Dominican descent and all the members of our community from the Dominican Republic a happy 179th anniversary of the proclamation of the Republic and national independence. And we join you in commemorating this occasion and celebrating the heroes and heroines in the fight for independence. Similarly, as many of you know, we in the USVI are embarking on the 175th anniversary of the Emancipation Proclamation, which ended chattel slavery in the Virgin Islands on July 3rd, 1848. And with that, I want to take this opportunity to note that Wednesday, March 1st, begins Virgin Islands History Month. And I want to take this time on behalf of Governor Bryan to recognize the extraordinary history and culture of our Virgin Islands and the achievements and contributions of its people. As Virgin Islanders, we must celebrate the resilient spirit of our ancestors and continue to push forward in building upon their many hard-fought achievements, but not to remember the achievements and accomplishments of those outstanding Virgin Islanders past, but also to acknowledge those of the Virgin Islanders living as well. We have Virgin Islanders who every day are not only making Virgin Islands history, but making world history. And so we want to celebrate those individuals and give them their flowers while they can still smell them. So with that, I will turn over this afternoon's briefing to Dr. Ty Hunt Caesar. Dr. Hunt.
Thank you, Director Motor, and good afternoon, everyone. As always, it is a pleasure to provide you with health updates on behalf of Commissioner Encarnacion. Today, we will present our numbers and share some important information on what is known as long COVID. Today, we have a total of 31 active cases in the territory, 19 on St. Croix, 11 on St. Thomas, and 1 on St. John. And our current hospitalizations territory-wide total 2, 0 on St. Croix at JFL and 2 on St. Thomas at SRMC or RLS Hospital. Last week, the Department of Health acknowledged the presence of the newer variants or subvariants here in the territory. Our latest sequencing results indicated the majority of the variants currently seen in the Virgin Islands are XBB and BQ1. Vaccines and testing remain available on all 3 islands. Please remember that the bivalent vaccine is still the best protection against COVID-19, and everyone aged 6 months or older is urged to become vaccinated and stay boosted with the current recommended booster. If you have not become boosted with the bivalent vaccine, which became available in September of 2022, you are not protected against the latest COVID-19 variants. We are in a transitional phase of the COVID pandemic where the severity of disease is much less dramatic than it was during the first 2 years. I want to talk to you today about why the impact of COVID is not over. We are still seeing deaths associated with COVID infection, but most people, whether vaccinated or not, are only experiencing mild to moderate symptoms. This is the expectation at this point in time. The milder effects on the population are the expected natural progression of disease, as the virus is no longer novel to the general public. However, the natural progression of this disease also includes the long-term effects that are common to essentially all viruses. In early 2021, shortly after the COVID-19 pandemic was declared, many people with COVID were not recovering as expected. These people were presenting with symptoms that persisted or emerged weeks or even months after the initial infection had passed. The term long COVID was later used to identify patients who continued to experience post-infection symptoms, but has also been referred to as long haulers. Today, long COVID is described as a complex disease that can affect nearly every organ in your body and is not one condition, but instead possibly overlapping conditions, several overlapping conditions, which with different causes and with different risk factors. Research and data collection continues to provide fact-based recommendations. Here's what we know. Long COVID is characterized as signs, symptoms, and conditions that persist beyond an active COVID case, or which develop long after recovery from the initial infection. And there have been at least 200 symptoms that have been reported or identified involving every part of the body. It can be something as simple as a lingering cough, mild shortness of breath, excessive tiredness, or as severe as a permanent heart condition, or the loss of the ability to concentrate. Many people say, I just don't feel like my normal self ever since I've had COVID. Long COVID can develop as early as 4 weeks after the initial phase of the infection. It can be the cause of newly developed chronic conditions that affect the heart, the brain or nervous system, kidneys, lung, blood or bone marrow, or psychological or mental health disorders. It is very important to know that long COVID symptoms can relapse and recur with progressive worsening over time, leading to possibly severe debilitating conditions or even life-threatening events for sometimes months or years after infection. The Association of State and Territorial Health Officials, or ASTO, is working on policies that will focus on how we collect data, review cases, and provide assistance to those affected. Here at the VIDOH, we have received a health disparities grant that has allowed the opportunity to increase access to healthcare prevention and achieve healthcare equity in the community. The VIDOH Health Disparities Office has initiated data collection focusing on the local prevalence and impact of long COVID with the utilization of our community health workers. Kudos to the team. From the national and international response, medical research organizations like the Centers for Disease Control and Prevention and the U.S. Department of Health and Human Services, along with the World Health Organization and others, are conducting comprehensive research projects to look more closely at this phenomenon because of the significant public health impact of long COVID. Some findings are already reporting this in their findings in medical literature. According to the HHS, National Research Action Plan on Long COVID Research Project, 1 in 5 adult COVID-19 survivors aged 18 to 65 years and 1 in 4 survivors aged 65 and older have a health condition related to their previous COVID-19 illness. A recent CDC study estimates that millions of U.S. adults have new long-term symptoms that limit their daily activities and that women may be more severely impacted. Also, findings from the Census Bureau's online household pulse survey based on self-reported data from adults showed that nearly 1/5 of those who had COVID-19 reported currently having long COVID symptoms. The majority of the takeaway from all this research is that long COVID is a real condition. It is having a significant impact on a large percentage of the U.S. population and will most likely continue to occur as new infections happen. This is a major public health concern. So let's talk about what this may mean to you. Based on the study cited earlier, data showed that 44% of people with long COVID indicated the inability to work at all, and 51% had reduced their work hours. Furthermore, it is estimated that roughly 1 million workers may be out of the workforce at any given time due to long COVID. The research equated this loss in worker productivity to approximately $50 billion annual in salary lost. There's also additional health care costs associated with the management of chronic conditions such as possibly the resulting of hemodialysis from end-stage renal disease. So who will be impacted most by long COVID? The data will tell us. But it is anticipated that there will be racial and ethnic minority disparities with long COVID similar to the rates of severe disease and death with initial infections. COVID has negatively impacted or affected blacks and Hispanics in comparison to other racial and ethnic minorities. Specifically, blacks and Hispanics were 2 to 3 times more likely to be hospitalized compared to whites. These numbers show us why we should pay attention in the territory. Long COVID's consequences are being felt by you, the healthcare system, the economy, and society as a whole. Historically, past pandemics like the flu or polio have had long-lasting impacts not just on the nation's healthcare delivery system, but also on healthcare costs, health insurance, employment, and the education system, the economy, and much more. There's no reason to doubt that COVID-19 and long COVID will have similar long-lasting effects that are only just beginning to be recognized, assessed, and understood. How can you prevent long COVID? Simple. Avoid getting infected by practicing good infection control practices, with the first one being vaccination and boosting with the most current recommendation. Remember, the vaccines continue to change to target the most current variants of the virus. Wear a mask in crowded areas or when there are high numbers in the cases in the community. Wash your hands and keep the environment well ventilated and clean. The end of COVID-19 public health emergency does not mean the effects of the pandemic will not continue, nor does it mean that we will not continue to experience additional active cases, hospitalizations, deaths, or the effects of long COVID. And this is why the Department of Health continues to emphasize that the best way to avoid COVID-19 and the effects of long COVID is to prevent infection by becoming vaccinated, boosted, and by continuing to rely on the protection afforded by social distancing or wearing a mask in crowded settings and by frequent hand washing. Thank you for the time to share this information with the public, and I'll be happy to answer any questions. Back to you, Director Mota.
Thank you, Dr. Hunt-Caesar. As I mentioned at the top, we have Commissioner Kimberly Causey Gomez here from the Department of Human Services with us to discuss what the end of the public health emergency on the national level means to local Medicare and SNAP recipients. Commissioner?
Good afternoon, Virgin Islanders, and thank you, Director Mota, for allowing me the time to talk about some important deadlines that we have for both Medicaid and SNAP, and what you can do as a community to help us help you. At the start of the pandemic, Congress enacted something called the Families First Coronavirus Response Act, which included a requirement that Medicaid programs keep people continuously enrolled through the end of this month. That would be without interruption to your benefits. As the COVID-19 pandemic public health emergency is ending, it's in exchange for the enhanced federal funding. Medicaid enrollment in the territory has grown substantially compared to before the pandemic, and now the uninsured rate has dropped. However, when the continuous enrollment provision ends, many Virgin Islanders could lose coverage if you were a Medicaid member. As part of the Consolidated Appropriations Act 2023, signed into law on December 29, 2022, Congress set an end of March 31st for the continuous enrollment provision and phases down the enhanced federal Medicaid matching funds through December 2023. So what does this mean for you as a Medicaid member? So during the public health emergency for COVID-19, Medicaid members, remember, they had continuous coverage. The public health emergency is now ending, and soon, if you're currently a Medicaid member, it's really important that you make sure that DHS has your current updated information, and that includes your mailing address, your phone number, and your email. This is a way for us to be able to communicate with you to talk about your updates in your coverage. It's really important. So you're going to go to our website, dhs.gov.vi, and click Update My Contact Information. This will be able to provide us information about you. You're also going to be checking your mail, your postal mail, the snail mail. DHS will mail you a paper letter about your Medicaid coverage. This letter will let you know if you need to complete a renewal form to see if you still qualify for the Medicaid benefits. Because we have a new Update My Contact Citizens portal that will also provide Medicaid members an easier way to provide the most updated current contact information, including a cell phone number, an address, and a mailing address. This allows us to provide text messages to you at no cost, but updates on your information. We'll also because of that messaging capability, we can send you that text message, and it'll contain a link that you can automatically update your contact information. So you don't have to come into our office, you don't have to stand in any lines, you can do it right from your phone. So the link to the online portal is also available by going directly to the VIDHS website at, again, www.dhs.gov.vi. www.ws.vi.gov. And there's a DHS Universal Access Portal. So just like your phone, if you get the text message, you can also do it online on our website. So tomorrow ends February 2023, and it's the last day that SNAP recipients who've been receiving the temporary emergency allotment that's provided throughout the pandemic. Beginning in March 1st, 2023, all SNAP households will receive their normal monthly SNAP benefit, and as long as they remain eligible based on their federal guidelines. On March 1st again, when the temporary emergency allotment expires, each SNAP household will again, as was the case before the COVID-19 pandemic, will begin to receive benefits based on their usual factors in determining the eligibility. That includes their household size, their income, and any deductions. Therefore, each household's benefits will vary based on the current circumstances, which may have changed since before the pandemic, which is important for your context. Households will receive the decreased SNAP benefit amount on their EBT card. And just to let you know, if you are a current SNAP consumer, you do not have to do anything. This is automatically, you have no action to be taken, unlike Medicaid. Since March 2020, our DH team has worked tirelessly throughout the public health emergency to ensure our 11,000 plus SNAP households receive the maximum benefits we could, assisting both not only the families and the Virgin Islands economy. At this time, households should prepare to accommodate this reduction in benefits when the additional temporary emergency allotment ends after the end of this month, which is tomorrow. And as a reminder, the change to your benefit amount is due to the 2023 Consolidated Appropriations Act, due to Congress, and the department doesn't have any control at this time over that federal change. So thank you, Director Mota, for the opportunity. I'm happy to answer questions, and we'll have people on the chat as well as needed.
Thank you, Commissioner. In closing this afternoon, I want to remind the community of a series of upcoming town hall events hosted by the Department of Planning and Natural Resources on the planning process for the development of a comprehensive land and water use plan for the territory. There will be 2 town halls held on each island beginning tomorrow. Yes, 2 town halls on each island. So all 3 islands, there will be 2 town halls on all 3 islands, so a total of 6. Beginning tomorrow, Tuesday, February 28th, at DPNR's offices in the Via building at Tutu Park Mall, and that's in St. Thomas, and they will continue through Wednesday, March 8th. And so for more information on the additional dates and just for some general information on the development of the comprehensive land and water use plan, you can visit planusvi.com. Again, that website is planusvi.com. And then, of course, you can always visit the Department of Planning and Natural Resources' website, which is dpnr.vi.gov. That concludes our briefing this afternoon. I see that we have Suzanne Ellis from the Virgin Islands Source joining us virtually. Go ahead, Suzanne.
Thank you, and good afternoon.
Good afternoon.
First, a question. That's easy. Actually, 2 questions. Is there any way to track the death rate among long COVID, and do they, does any one of the variants, is any one of the variants attributed to more long COVID cases?
So for your first question, what we would have to do is start to begin to collect the information and the data on long COVID. And I'm assuming that you're talking about within the territory, or are you talking about nationally?
Either.
Okay, so nationally, I don't have that data, but that might be something, if they have already collected it nationally, that we can try to track down. But we don't have local reports as yet. Our Health Disparities Office is working with our epidemiology team to try to begin to track the numbers of long COVID, and then we would be able to then sort of collect the data on any deaths that have been associated specifically to long COVID. Off the top of my head, just for general knowledge, because I usually have a general sense of that within the territory, We're not tracking any deaths that have been associated for long COVID. Usually, if it has been associated with recent COVID infection, we then characterize it with a COVID-associated death, but haven't teased it out necessarily if it was associated with long COVID. But we can start to develop our plan for how we're going to report that within the community. And your second question, I can't remember.
The second question was, is any one variant responsible for more long COVID cases than another?
Not to my knowledge. And I'm not tracking that, that distinction between the different subvariants, but I'll have to do a literature search to see if there was one, but it's not been something that we have been reported on our weekly calls that I sit on with to track and talk about the variants, how they are reflected or how it's being tracked around the nation. That has not been something that they have been reporting to us nationally, but I'd have to do a literature search to see.
Okay, thank you. And for Commissioner Causey Gomez, a couple of questions.
Sure. Good afternoon. Hi, Susan.
Hi.
Good.
You have so much information packed into a few minutes. I'm wondering if you could condense it to, from what I understand, everybody that's on Medicaid will have some sort of impact through after March 1st. And SNAP, not so much. Is that close?
So Medicaid, you're going to update your contact information. And the reason for that is because we've had a continuous enrollment, meaning that you didn't have to recertify for Medicaid. SNAP doesn't have to do anything at all because it was an emergency allotment that was added to your already existing benefit, and that's just now ending. So SNAP, you don't have to do anything at all. Medicaid, it's important for us to update the contact information because we have to make sure that you can recertify and you meet the eligible requirements for Medicaid moving forward. And just as a recipient of eligibility for both programs, in the event that your circumstances ever change, meaning that you increased income or you lost your job, anything that is an eligibility requirement up front and that changes, it's really important for you as the member to let us know in those changes as well.
Okay, just one more question. Does that mean that during COVID, you had more people on Medicaid and why?
So yes, we had an increase for Medicaid eligibility for a variety of reasons. You can be presumptive or eligible. Because of that, we had an increase, probably almost 6,000, 7,000, 8,000 people additionally that would have normally been pre-pandemic. So now that that public health emergency is ending, we now looking at your eligibility requirements, your real eligibility requirements. And if you don't meet the guidelines, then you will not have Medicaid health insurance.
Okay, thank you. Thank you, Richard.
Thank you, Suzanne. I believe that concludes our media questioning for this afternoon. With that, I would like to just thank you for taking the time out and listening to us this afternoon, and to invite you to participate next week, which is that March 6th, and I'm pretty sure that it's not a holiday, and so we'll be right here with you at 1 p.m. So stay tuned, and we'll see you then. Have a good afternoon.